Well, here we are today with Dr. Marsha Brendan, an optometrist from Laingsburg, Michigan. Did I pronounce that right, Dr. Brendan?
Yes, Laingsburg is correct.
Okay, where in relation to a big city is that? Maybe that is a big city and I just don't know about it.
No, Laingsburg is actually a very small city, just on the outskirts of Lansing, East Lansing.
Okay.
So we're close to the heart of Michigan. All
right. Well, Dr. Brendan, you're an optometrist. Tell us a little bit, you see, maybe as patients we're not quite sure, is every optometrist the same? Is there a difference at all? So give us a little bit your philosophy of your practice, and maybe even, Dr. Brendan, maybe even tell us how you became to become an optometrist. What, drove you to become an optometrist?
Well, actually, optometry was a second career for me. I used to be an elementary school teacher. I started to be afraid I was going to be an old maid school teacher, so I thought getting back to school would give me the way to find somebody. Also, I emphasize teaching reading, and vision is very important to reading. And some of the things I was learning in my master's in teaching reading was about coordinating the eyes, and optometrists get into that quite a little bit. So
it's an extension, actually. So basically, you probably have a bunch of stories to tell where students are somewhat deemed to be a little bit on the dumber side, when really they just weren't able to read the damn blackboard. Yeah?
Right.
I think that happens a lot, that we look at people a little bit as, being not quite so bright when they have a hearing problem or a reading, a seeing problem. And then of course that makes us look awful stupid. I know the first time I was not able to fill out the form at a bank without my reading glasses, and my wife was there, and she said, "You acted like a jerk, like an idiot, like a dummy."
Illiterate, huh?
I said, "Honey, I couldn't read it." She says, "Well, why didn't you say so?" I go, I was way too shocked to even figure out what was going on. Yeah. So, all right. Now tell us a little bit about the type of patients you see in your practice.
Oh, I see patients from infancy all the way up to, 90 or 100 years old. Mm-hmm. And we primarily do glasses and contact lenses, and then when people have injuries of the eye, we're as available as possible to help them with their injuries if they're not too severe.
Okay. What is some of the main thing why a person should go and examine his eyes?
Well, a routine eye exam is very important when you're young, because there's some developmental stages that are crucial. If something's wrong, your eye won't develop correctly, and that eye may remain blind for the rest of your life if we don't catch it in time. And then as time goes on, it's about giving you the optimal vision so that you're able to enjoy life. Your quality of life will be better, and you'll be able to learn. And then as you get old enough to drive, for safety reasons, it's important. And depending on your job, there's other reasons to keep your eyes safe. And then as time goes on, other things that happen to our bodies, like high blood pressure, heart disease, can influence the health of our eyes. Glaucoma would be an example of an eye condition that you don't get a lot of symptoms for until it's too late. So routine eye exams could prevent blindness in many cases.
So what you're basically saying is that eye problems creep up on you. You don't notice it till basically you're not necessarily blind, but definitely rather handicapped and irreversible at that moment.
You glitched out the last thing you asked me in that question. I couldn't understand.
Yeah, we were breaking up here. What I said is, it looks like that eye problems are something which creep up on you, and then they go kind of like, once you see it, it's too late. Then you are maybe not completely blind, but definitely very handicapped, and most likely the situation is also irreversible at that time.
sometimes it's irreversible, but other times simple solutions like glasses or contact lenses are all you need to help. Or maybe a medicine even.
Right, but the point is, if what I was getting at, if you wait for it too long, then you might perhaps you might develop some situations which you could have prevented, but if you didn't, they're irreversible and you're stuck with it for life.
Exactly. Examples of that would be diabetic problems, hypertensive problems, and glaucoma problems.
Mm-hmm. Right.
Possibly tumors of the eye. That's even life-threatening, not only vision-threatening.
Okay. Well, all right. Well, thank you for giving us an overview about optometry and about your practice, and very interesting on how you actually became an optometrist. Thank you very much, Dr. Brendan.
You're welcome.